Turning to today's numbers, over the last 24 hours, we have identified 1,854 new cases of COVID-19 in Alberta and completed more than 19,600 new tests. Our provincial positivity rate sits currently at about 9.5%, and we now have 17,743 active cases. There are 511 people currently in hospital, including 97 who have been admitted into the ICU. These numbers are very concerning, and I know that AHS is watching them closely. Sadly, there have been 14 deaths related to COVID-19 reported to us in the last 24 hours. Sharing the number of lives lost is a little more difficult each day because I know the pain and sadness their deaths cause for the family and friends who are left behind. They are not just a statistic of COVID-19. They represent Albertans who were loved and who meant the world to those who loved them. My deepest condolences go out to everyone mourning the loss of someone special from any cause, especially as we get closer to the holidays. In schools, there are currently active alerts or outbreaks in 407 schools, or about 17% of all schools in Alberta. Currently, these schools have a combined total of 1,561 active cases. This number includes 220 schools with outbreaks, including 100 currently on the watch list. Since new measures were introduced last week, we've received many questions. One of the themes is about carpooling. To clarify, the guidance about carpooling remains the same. Whenever possible, individuals should limit group travel to members of the same household. If that is not possible, we recommend that the number of people in a vehicle be limited to allow for 2-meter distancing between each other. Passengers should wear masks and wash or sanitize their hands before entering and after leaving the vehicle. As well, we encourage having disinfecting wipes available for each passenger to wipe down their side of the vehicle. More detailed guidance on carpooling, along with taxis, limousines, and ride shares, is available at alberta.ca/COVID-19. With the enhanced restrictions, I know there is a lot of information to take in. I would like to thank the many Albertans who are following restrictions to the best of their ability and who are asking these types of questions when they are unsure. This is a great example of Albertans doing everything in their power to protect one another. Knowledge and information from accurate sources is an important part about this. I want to end today by talking specifically to Albertans who don't live in Edmonton, Calgary, or surrounding areas. We are seeing rising COVID-19 transmission across the province. While infection rates in Edmonton and Calgary make up the majority of cases in the province, we are seeing increased spread in many rural communities. COVID-19 is not a Calgary problem or an Edmonton problem. This is a provincial problem within the context of a global problem. When you look at the 15 local geographic areas with the highest active case rates in Alberta, a third of them are outside of Calgary and Edmonton. We are also seeing growing outbreaks in the central, north, and south zones. I know that many rural areas did not see widespread transmission in the spring or summer, and so it's natural that some people living in those areas may feel safe from COVID due to their smaller populations or distance from large urban centres. They may wonder why they should wear a mask or not host a party in their home. Unfortunately, our overall active case rates prove that COVID-19 doesn't care where you live or what your postal code is. It only takes one case entering a community to cause significant spread. That is why it is important that we all follow the key public health measures wherever we live. If people in a community aren't consistently observing physical distancing, wearing masks when appropriate, or staying home when they feel unwell, it doesn't take long to infect a large percentage of the population. Coping with this virus is a challenge for everyone, but being further away from healthcare, especially from advanced services like ICUs, can also make the experience even more daunting for those living in rural areas. That's why it's important that all Albertans, rural and urban, take COVID-19 seriously and do everything possible to limit the spread. We are all Albertans, and as a province, we are all in this together. Thank you, and I'm happy to take questions.
All right, we'll go to the phone now. Operator, could you please put through the first caller? Operator, are you there?
Yes, first is Emma Graney with the Globe and Mail. Go ahead, Emma.
Yeah, good day, Dr. Hinshaw. I want to ask you a little bit about contact tracing. This has come up a few times, and you kind of referenced it there, saying, you know, thanks for helping out and such to get in contact. But there are some companies, private companies, corporations that are kind of developing their own tracing teams because the AHS contact tracing system has basically failed. So how concerning is it? You've got some oil companies, for example, doing this. How concerning is it that they're doing that? And do you have any broader thoughts on how contact tracing is looking right now in Alberta? Have you hired more people? Is the system still crumbled, or are we looking a little better place now?
Our contact tracing system is still struggling, as I've said before, under the volume of new cases that continue to increase, unfortunately. And so absolutely acknowledge that this is not an ideal scenario, and AHS is working to recruit and train more contact tracers. They would have a more precise number, so we can maybe follow up with AHS to identify exactly where they are right now with respect to the hiring. But in this short-term period where we are not able to complete all case investigations and contact tracing as quickly as would be ideal, this choice by some companies to work on building their own contact tracing, while again the ideal scenario and what we're working towards with AHS is having enough capacity within the Alberta Health and Alberta Health Services system to be able to do all of that work. At the moment, I want to express my gratitude for those companies and individuals who are working, again, whether it's in a work setting, to make sure that those who are in close contact are notified and know what to do, or those individuals who are not in those key settings like long-term care or health care, who are left with that task of notifying their own close contacts. And I know that that's not easy, but in this time period where we're working to increase our capacity, it is absolutely essential that we all work together. And again, really grateful for those who are stepping up to participate in that work in the short term.
Operator, could you put through our next question, please?
Next is Jesse Weisner with Global TV. Go ahead, Jesse.
Hi, Dr. Hinshaw. We've been made aware of some COVID cases at Chinook Mall, but Alberta Health Services says it isn't considered an outbreak as there aren't 5 cases inside one single store. Can you confirm how many cases have been reported in the mall from Black Friday onwards, and weigh in on the fact that the mall hasn't made this public to shoppers when there's no fulsome contact tracing right now from the government? Should shoppers just be avoiding malls as it's hard to find out if they've been exposed?
I don't have a specific number of cases from any particular malls. I can say that anyone who was potentially exposed during Black Friday shopping, it would, again, while it can take up to 14 days for the illness to develop between exposure and when someone gets sick, most people, the majority of people seem to get sick between about days 5 and 8 of when they had an exposure. So I would expect that we wouldn't have diagnosed cases yet who potentially were exposed or acquired it through an exposure that happened on that particular day. So the cases that we might be identifying now could potentially be those who could have been infectious at that time. I would say that no matter the scenario, whether it's a shopping mall or any other scenario right now, you know, we've been clear that unfortunately in this short term, our contact tracing has not been able to keep up with the significantly accelerated demand and the number of cases that we're currently seeing. And so we're really asking all Albertans through the measures that we put in place last week, as well as those key measures that I reiterate on a regular basis. If you have a choice of an activity and one choice of activity will keep you 2 meters distant from all others, and you're not going to be having any close contact with people, and the other choice of activity you may be within close contact with people, choose less close contacts in any activity. And that would be my advice, whether or not we had a contact tracing system that was keeping up with all of our cases or not, because ultimately the more that all of us can limit our number of close contacts, the more quickly we'll be able to keep our numbers down. And again, that would be independent of that ability to trace close contacts. But in this context, it becomes even more important.
Operator, can you put through the next caller, please?
Next is Sean Fournette with CTV. Go ahead, Sean.
Hello, Doctor. I'd like to ask you about the situation at Clifton Manor in Calgary. The operator says they're up to 84 cases, which has been quite a rapid rise recently. How concerned are you about that specific situation? Is the province close to stepping in and maybe taking over operations at that facility because of this quick rise? And also more generally, we've heard about the province looking into contingency plans for hospitals in Alberta, potentially having field hospitals. Is there a similar contingency plan for care homes in Alberta if situations like the one at Clifton Manor continue to grow at these type of rates? What is the contingency plan for care homes if things get out of control and the province needs to step in to provide more care?
The information I have on Clifton Manor is a little different from what you received, but again, these are the number of cases as of yesterday, so it's possible that there may have been a change, but the number I have is 75 cases in total, 67 of which are currently active. So of course, any care home that is having large numbers of cases is a concern. And our teams, both at the Ministry and Alberta Health Services, work very closely with all continuing care sites that have an outbreak, particularly those where case numbers have risen. And so I don't have any specific information about what is being done on the ground in Clifton Manor, but again, I do know that our teams do support all the continuing care sites with cases, and that extra support and on-site visits happen when sites have rising numbers of cases. So we can talk to those teams and confirm, what's exactly happening at Clifton Manor. The question about contingency planning with respect to continuing care, we know that staffing levels in continuing care is a challenge, and being able to meet the demand, especially when sites experience outbreaks, is part of one of the greatest difficulties for operators. And so our teams in the Ministry who work in continuing care policy, as well as those in Alberta Health Services who work in seniors and program delivery for seniors in continuing care, are working on options and ways to support these operators and to support these sites. But I don't have the details of exactly what's happening. Again, that's something that we could potentially follow up and get back to you with.
Operator, could you put through the next caller, please?
Next is Rick Westhead with TSN. Go ahead, Rick.
Hi, Dr. Hinshaw. When Hockey Canada and the province agreed to hold the World Juniors in Edmonton, the amount of virus in the province was different than it is today. As Alberta's caseload climbs, what's your outlook now on holding the tournament in the province?
We have been in discussions with Hockey Canada and continue to look both at our own case numbers as well as the protocols that have been proposed. Even though the NHL bubble happened at a time when the case numbers in the province were much lower, the ability to ensure that players within that kind of bubble scenario stayed separated from community transmission and also did not bring in virus to put those in the community at risk. That model did show that could happen, and so we're continuing to have conversations with Hockey Canada to look at both our current situation and their protocols. And so I would say that that decision has not been changed at this point.
All right, we have to end it a bit earlier. We've got 3 more questions. Operator, could you put through the next caller, please?
Next is Jeff Levine with the Edmonton Journal. Go ahead, Jeff.
Hi, Dr. Dr. Hinshaw. Over 19,000 tests were completed yesterday, so it got me wondering if there's any discussion around expanding test capacity.
So certainly we have been working with the lab to push the ceiling of testing. You'll note that over the last week we've had a few days where we have tested more than 20,000 samples. And so the key metric that we're tracking is the timeliness of testing. And again, we've been working with the lab to shorten the turnaround time between when a swab is taken and when the result is available. And that, again, is linked back to our ability to move through as many samples as we can in a day. And so right now, again, we're hitting our mark for how many samples we expected that we would need to be able to process. And that key metric right now is making sure that we can reduce the turnaround time. And once we can do that, if there's any consideration of expanding the number of tests per day that's done, that would be a next step.
Operator, could you put through the next question, please?
Next is Julia Wong with Global News. Go ahead, Julia.
Hi, Dr. Hinshaw. What led to the province's decision to release comorbidity information about COVID-19 patients? The release of this information seems to some doctors to shift the blame to the patients themselves and lessen the severity of the virus. How do you respond to that? And again, what led to the decision to release it?
In our dashboard, we've always provided information on severe outcomes, and we've always provided information on comorbidities and the proportion of people who have severe outcomes who have been diagnosed with one or multiple comorbidities. So that chronic condition information has always been present. It's been a part of the dashboard since we began publishing it in the spring. The additional piece with respect to deaths is to try to provide additional information to Albertans. But I want to be clear, as I said in remarks a couple of weeks ago, that the presence of any chronic condition is not a death sentence and should not be. And so whether or not an individual who passed away had a chronic condition or not does not mean that that death was less tragic. We also have a risk assessment tool that's online to help those who do have different kinds of chronic conditions understand what their particular risk is based on the specific kinds of conditions they have, and that's a tool that we have updated over time as more information has become available, both through our own data in Alberta as well as publications from around the world. And so again, it really is to highlight that this is something that does disproportionately impact individuals who have chronic conditions. And it is up to every single one of us, whether or not we have a chronic condition, to be a part of the solution and to be a part of protecting everyone in our society.
All right, operator, could you put through the final question, please?
Yes, our final question is Aaron Collins with CBC National. Go ahead, Aaron.
Thanks for taking my question, Dr. Hinshaw. It's been a week and a half since the latest restrictions were put in, but we're seeing, record highs in cases and hospitalizations, positivity rates today. So I'm wondering, if those measures were enough to bend the curve, would we already have seen their impact? And if not, when would you expect to see some dip in these numbers because they seem to keep ticking up?
The first set of measures last week, as you'll recall, became effective as of Tuesday, and the second set were effective as of Friday. So that full combined impact of both of those sets of measures we wouldn't be starting to see yet at this point. As I mentioned earlier, it does take usually about 5 to 8 days between when someone's exposed and when they start to have symptoms. And then, again, based on our current turnaround times, it can be 2 to 3 days between when someone goes for testing and when they get their test results back. So the bulk of these numbers that we're seeing today would be from transmission events that would have happened prior to those restrictions. However, very soon, over the next several days, I would anticipate we would start to see the early impacts. Of course, we won't see the full impacts of restrictions until another week or so have passed. But we are, as always, watching very closely. As I said earlier, I am very concerned about these numbers. And the actions that all of us take today will determine the outcomes of our numbers in the next 2 to 3 weeks. And so, again, no one should be watching these numbers to determine whether or not they need to change their behavior. Behavior needs to change, and that's already a mandate. And what we need to do as we're watching these numbers is determine whether or not there should be further changes.
Thank you all for joining us today. Dr. Hinshaw will provide another update tomorrow afternoon. Have a safe night.